What about our natural voices? What makes someone have a deeper voice than someone else? How does that work?
Well, the most obvious first branch point is man versus woman. Obviously, women have a voice that's about double the frequency. The frequency of a woman's voice is about 200 to 220 hertz, whereas a man's about 100 hertz. And that's because of the length of the vocal cords and the mass of the vocal cords, how much they vibrate. The way I like to describe it's like a flag. If the flag's getting enough wind, it vibrates or undulates in the air, and that's because of a certain weight that it has. If it gets too heavy, it vibrates at a lower frequency. If it's too light, it vibrates at a higher frequency. The other things that make up the voice, is what you see here, is the way that the sound resonates through your throat, your nose, and your sinuses. So you could take the same vocal cords and you take them outside the body. The vocal cords just sound like a noise box. Just make
right.
But what makes you you is how that sound goes through your throat, your nose, and your mouth. And that varies from person to person how they're built.
That's fascinating. But we have to talk about puberty, though, a little bit, because there's always that change in your voice when you're in puberty. So what causes it?
Well, as the hormones take flight, as we go through puberty, the vocal cords lengthen. And so for a man, they become much longer. As for a woman, the thickness of the vocal cords changes a little bit. They develop more of their mature 3 layers, and that changes the way they vibrate. And so for a woman, oftentimes a woman actually becomes a little bit deeper as well, but a man becomes much deeper just from the positioning of their voice box and the lengthening of the vocal cords.
Wow. Now, are there things you can do to change the sound of your voice?
Yeah, the biggest way I usually get approached for this is people who are trying to do transgender changes, specifically, going from man to woman or woman to man. I don't personally do these surgeries anymore, but that's just to change the amount of vocal cord tissue that's vibrating so that you can get the different quality one way or the other.
So it's dependent on tissue?
It's dependent on the tissue and the resonance. I mean, I have a lot of my patients saying, after my vocal cord surgery, my voice surgery, will I sing like Adele? And my first question always is, could you...
No one can sing like Adele.
I was like, could you sing like Adele beforehand? And by and large, they couldn't, and I say you won't after.
Right.
Because what makes you you, it's your vocal signature. I mean, I can change the way the vocal cords vibrate and give you a clear-sounding version of you, but I can't change the way you sound, because that's from all the other things, the resonance chambers.